Well, the NICD has been tracking measles cases since October, when the vast majority were recorded in Limpopo. Let's talk more now with Lumka Mangojoane, Free State Health Department Director for Women and Children's Health. A very good evening to you, ma'am. Thank you for your time. So we're talking about an increase in measles cases, predominantly in Mpumalanga and Limpopo. How's it looking in the Free State?
Okay. Good evening, Tembekile and the listeners. Currently in the Free State, we have 7 cases that have been reported or confirmed from NICD. These are from the week of 46, which was in November, and to date. So we're still having 7 cases. These cases, the first case was at, sorry?
No, I was just saying, pardon me for interrupting, please continue.
Okay. The first case was reported at Kharib district, and the child was fully vaccinated. And our second case was reported at Fezletabi, and also the child was fully vaccinated. And we have 5 cases in Thabo Mfutsanyana district, where 1 is in Getwana, where the child is also fully vaccinated, and we have 4 in Dihlabeng sub-district, where the children are not vaccinated at all.
And the data of the 7 cases of measles in the Free State, as you said, goes back to November. Is there a likelihood that there may very well be more? They've just not presented at a hospital or a clinic?
At this stage, we cannot say we have more, because until the cases have been confirmed from NICD, one cannot conclude that we have more cases, but we would just say we have 7 because these are the confirmed cases in the province.
How easy are measles cases to confirm?
The measles cases, it's when a child would be presenting in our healthcare facilities with the symptoms of measles, and then the child would be investigated, and then blood samples are sent to NICD. And then NICD would inform the province if the case is confirmed or not.
Limpopo and Mpumalanga are on a massive drive currently to encourage parents to have more children vaccinated against measles. Will the Free State be doing the same, given that your caseload at this point is a mere fraction of what they're dealing with?
Okay, well, we have already started looking at the cases that we have seen in Dihlabeng, which is in Thabo Mfutsanyana. We have activated our outbreak response teams to investigate most of the children. And we have started with massive screening in that sub-district, where we have currently screened about 158 children, of which 123 were given vitamin A, and 25 were given measles 1, and 37 were given measles 2. And the alert has been sent out from the province to make the communities aware that we have this outbreak of measles countrywide. And remember, we are a province that is in between, so there is almost movement in and out of the province, so risk communication has been strengthened. And the province will be starting to screen in the port of entries, because we also bordering countries like Lesotho.
Are you satisfied, though, based on the available data that the health department has, with the level of vaccination, the vaccination rate among children in the Free State overall?
Currently, with the measles vaccination, we're still not doing well as a province, because we are expected to be at 95% in terms of measles vaccination, but the province is still at around 87%. So the province still needs to do more to ensure that we reach a lot of children with vaccination. However, what is also of concern is, the children in some of the informal settlements where the parents are not bringing children to the healthcare facilities for vaccination, and those are the areas where the province is embarking on outreach services to those hard-to-reach areas.
In those areas, is it a matter of location, or is there another reason why vaccination levels there are particularly lower than, let's say, in more urban spaces?
Yes, in some informal settlement, you find the clinics are a bit far, and those are the areas where we encourage the districts to do outreach services using mobile services, because it's a long distance for the mothers to travel with their children. And of course, we still have some cases where you find there is sort of vaccine hesitancy, where parents don't believe in vaccination of some of their children. And we are embarking on advocacy in terms of addressing some of the parents with the importance of vaccination to the children, for the children.
Just on vaccine hesitancy, in your years with the health department, have you found that to be a new problem? Because many people have essentially brought it down to vaccine hesitancy from around the COVID-19 period.
Yes, in terms of children's vaccination, it hasn't been a problem as such. However, what we are seeing now, since the COVID vaccination started, some parents still believe that children are vaccinated with COVID instead of, your normal vaccines that the children are supposed to get. And it's not much of a problem to say, because if we are at 87 and as a country we are expected to be at 95, it's not much of a problem, and those are the cases that we are dealing with.
If I can end then with your level of preparedness for the reopening of schools in January, and perhaps even your level of concern about a potential spread when the kids start to mix then with others from different households. Do you think that's when we're likely to see possibly a spike in measles cases in the Free State?
Tembekile, we are aware that there is a possibility of having a spike when the schools are reopening. Hence, in areas where there is low coverage, we are encouraging them to start already before the measles campaign, that they should start vaccinating children so that we are able to interrupt the spread of measles in those areas.
Lumka Mangojoane, Free State Health Department Director for Child and Women's Health. Thank you for your time tonight.